The CECC reported 33 local COVID cases on Tuesday, including multiple isolated cases with unknown sources of infection. The cases were distributed across the country from Keelung to Changhua.
The health minister confirmed that the risk of community infection has gone up. People should get tested if they have COVID symptoms, a contact history with known cases, or a travel history in known hotspots. But the health minister said that Taiwan will continue to ease restrictions as it shifts towards a policy of quote-unquote living with COVID.
It's true that the risk has gone up, the risk to the community. There are a lot of hotspots, so close monitoring is needed.
With outbreaks cropping up across the country, CECC Commander Chen Shih-chung urged the public to heighten its vigilance. 33 local cases were reported on Tuesday. Many were unrelated to each other and had an unknown source of infection.
There are 6 cases with infection sources yet to be determined. 2 of the cases are a family cluster. Altogether, we are still pursuing the sources of 17 cases. In the future, depending on the findings of our epidemic investigations, we may consolidate some of these cases under the same transmission chain.
Some of Tuesday's cases were part of known cluster infections, such as the ones at a Keelung restaurant, a Taoyuan power plant, and a Kaohsiung chemical factory. But other cases were isolated and had no clear source of transmission. These were found in Keelung's Anle district, New Taipei's Zhonghe and Danshui districts, Changhua, and Taipei. Over the past 6 days, Taiwan has racked up 200 local infections, most of which appeared in the last 3 days. Many had no workplace or geographic connection to known cases. On Tuesday, the CECC was asked if it might raise the national COVID alert.
The criteria for raising the COVID alert are no longer applicable. They can no longer be used. When dealing with Omicron, with such a highly transmissible virus, we cannot apply those same standards to bring society to a halt. Economically, it is completely unrealistic. But yes, controls are needed.
The CECC said the rules of the game had changed long ago and that the Omicron virus required a different approach. It said it would continue to ease restrictions gradually with the goal of coexisting with the virus. Self-protection is key to this approach, it said.
If you have symptoms, you need to get screened, and if you test positive, you need to report it. You need to tell your friends, the friends you were in contact with. You need to tell them as soon as possible. You need to take your health into your own hands. Of course, the same goes for businesses.
People with symptoms, a contact history with infected cases, or travel history in COVID hotspots are advised to go to a local COVID test site or take a rapid test at home. On Tuesday, the CECC expanded its network of home test kit distribution sites from 240 venues to 540 across the country.